Hello, everyone. Firstly, thank you for joining us today. I see that over 2,500 people are already connected. While the others are still joining us, I will take a moment to introduce myself. My name is Anna Lobanova, and I am the head of marketing at Bioscience GmbH. I will be your moderator today for our first webinar out of Aesthetic Reveal series. And I would like to extend a warm welcome to all of you. So Bioscience GmbH is a leading manufacturer of hyaluronic acid-based solutions for body and for the face. We are, with the 20 years of German expertise, the only holder of the CE mark for the body fillers, as well as the range of facial fillers as well. We are gold sponsor of ISAPS, and today, together with the association, we are proud to bring to you this webinar. We hope that you find this an experience insightful. Now, I will start by briefly introducing the agenda to you. We plan to reveal in this first webinar the results of the PMCF clinical study on safety of gluteal augmentation with HYAcorp body fillers. We will begin by our guest speakers, by Dr. Nazim Cherkesh, who is the president of ISAPS, and ISAPS member Dr. Ivar van Henningen. We will then move on to Dr. Fabio Fantozzi, who will introduce the results of the study to you. Then we will move to Dr. Krabai and his patient. They will share their first-hand experience as participants of this trial. Finally, to conclude, we will have Dr. Brambilla, who will explain to you the ongoing clinical studies from Bioscience GmbH. We will then finish with a Q&A session. And in that Q&A session, if you stay till the end, we will be able to automatically put you in a draw to win Bioscience trial kit and the training session. Now, let me move on to introducing our speakers. Firstly, we will begin by the president of ISAPS, Dr. Nazim Cherkesh, who is a worldwide renowned surgeon for his advancements in the plastic surgery field, and his colleague, Dr. Ivar van Henningen, who will speak about the patient safety guidelines of ISAPS. Then we will have Dr. Fabio Fantozzi introduce to you the PMCF clinical study. Dr. Fabio is a graduate of University of Sapienza in Rome, where he has conducted his residency as a general surgeon. He is a dedicated specialist driving the plastic surgery field in Italy and is affiliated with a lot of international organizations. Dr. Fabio has authored many medical papers. Some of them were also published in the European Journal of Plastic Surgery. So thank you, Dr. Fabio, for joining us today. Dr. Fantozzi will be followed by Dr. Piero Krabai, who is a graduate of University of Milan in plastic surgery. Dr. Krabai, with his 20 years of experience in the field, is frequently invited to the World Congresses as a speaker, and he has conducted also a lot of live demonstrations in different countries in the world. Dr. Krabai is often invited to World Congresses. Thank you, Dr. Krabai, for attending the session. We will then have Dr. Brambilla. Dr. Brambilla is graduate of the University of Milan, and he is a reference point for the Italian Board of Plastic Surgery and is also a member of ISAPS. As a specialist in botulin and hyaluronic acid, Dr. Brambilla is often invited to speak at the worldwide congresses. And with that, I will start moving into the presentation mode. Please bear in mind that we will be taking questions at the end. You can submit them by go to webinar panel question box specifically. And if we don't have the time to answer all of your questions, we will for sure email you the answers. you also, by staying till the end, automatically will be part of a draw to win the trial kit and a training session from Bioscience. This will be announced throughout our social media channels, and the winner will be also contacted personally by email, of course. One last comment before we start the session is that we have attached our product order form. So if you're interested in the product, feel free to submit this form and we will take your order. With that, I would like to welcome Dr. Nazim Cherkes and Dr. Ivar van Henningen to take over and continue with their presentation. Thank you, doctors.
Thank you so much, Anna. Thank you so much for inviting myself and our board member, Ivar, to this panel, this webinar as speaker. And I also thank Bioscience for supporting and sponsoring ISAPS. We do not have disclosure. I welcome all the participants to be part of ISAPS. ISAPS is the biggest international society in the world. And I would like to talk about ISAPS a little bit. ISAPS founded in 1970, and it is the world leading professional body for board certified plastic surgeons. Regarded the leading global authority on aesthetic and cosmetic surgery, ISAP's threefold mission is to offer aesthetic education worldwide, to provide accurate information to public, and to promote patient safety. ISAP's membership includes over 3,000 of the world's best and most respected reconstructive and aesthetic surgeons in over 100 countries, including resident members. We are close to 5,000 today. And we have a global alliance. ISAP's global alliance has 77 national societies, partners, and the goal is to improve connection between the societies. We have several benefits for our members, and I will talk about the benefits of our membership. If you are a member, you will have instant access to global network, and you will have a lot of friends from different countries, and you will have opportunity to meet experienced and accomplished plastic surgeons, and residents and fellows can participate in exclusive mentorship programs with experts in the field. And to be a member will increase your global visibility because ISAP's website receives around 45,000 hits per month from the colleagues, patients, and the media, and your visibility will significantly increase. And we have a wonderful extensive education program, which is our primary mission, and you will have an opportunity to attend ISAP's educational activities, which are ISAP symposia, ISAP courses, webinars. Now we are organizing weekly webinars, and next year they're gonna continue. Also, we will have different teaching activities. They are significantly reduced for the members, or free. Webinars are free for the members. So we have aesthetic plastic surgery journal. You will receive the journal free, and we have ISAP's news, ISAP's e-magazine. These are free for ISAP's members. And we provide a wide range of the insurance with significant benefits to our members. This is another benefit for the members. And we have ISAP's Med1. If you become a member, we have membership categories. You can use ISAP's Med1. You will have an opportunity to reach many books, and many teaching videos. And this is another membership benefit, important membership benefit. And we promote safety in aesthetic plastic surgery procedures. We're gonna talk about a lot about this safety diamond. We created ISAPS safety diamond, which is procedure, patient, facility, and surgeon. Slide, please. And for residents and fellows, membership is free. I invite all the participants who are not member of ISAPS to be member, and I say join ISAPS today.
Okay. Thank you very much, Nazim. My name is Ivo van Heiningen, and I want to thank Anna for inviting us to give a presentation on the guidelines. And as all of you probably know, is aesthetic plastic surgery is really big business. Every culture around the world looks for beauty, and we can ask ourselves, is it really important to be beautiful? And the answer is simple. Yes, it is. We really live in a visual world. We have an opinion about someone after a second, and we can only make a first impression once. So the non-verbal becomes almost more important to verbal, although I will try to at least present you with some interesting verbal content. The importance of beauty is expressed in all sorts of magazines, in all sorts of publicity, on television. So we have to realize ourselves that there are advantages of beauty, and that's why this industry exists. And the advantages of beauty are that beautiful people, they make more money, they live longer, they get more attention, and they are punished less. This book of Nancy Adcock is really worth reading, Survival of the Prettiest, and gives you some insight. Of course, since we all inherently realize that this is very important, there is a natural pursuit of beauty. We want to be beautiful at all costs. So what happens? The ladies go and look for jewelry, we buy clothes, we put cosmetics on, we go to the hairdresser, if we are allowed with COVID. And of course, we look for aesthetic medical procedures, such as Botox, fillers, laser, and of course also surgery. So we can ask ourselves, does that make aesthetic medical treatments commercial? Well, sure. I mean, it's all luxury. Governments charge VAT on it, and it's a patient, it's a client who sets the indication, and the treatments are not paid back by the health insurance anyway. So what we see in the world is that this pursuit of beauty leads to aesthetic medical treatment where the patient becomes a client, the procedure becomes an interesting road to income, the surgeon can unfortunately become anyone, and a facility, well, it can be done anywhere. And this is where Fouad Nahai's safety diamond comes into scope. We have to worry a little bit because aesthetic medical treatments, yes, they are commercial, but they are medical procedures and they can be very dangerous. So what do we see? All of a sudden, we see complication of all sorts of fillers, complications of laser epilation by estheticians, and yeah, we have to be honest, we also see complications of surgery. So what to do? Well, I think most plastic surgeons think that patient safety is the first priority, but unfortunately, governments don't think the same way. There is no government supervision in any country on these treatments, and generally they use the excuse that they're not paid back anyway, and they're all luxury. So in that sense, it's extremely important that we think that safety is our first priority. And we have to worry about the competence control of the doctors. We see that at least there is a university training of medical specialists. Nevertheless, we see that there are doctors who do breast augmentations who are not really trained to do that. Radiologists doing Botox injections, generalists doing liposuctions, and even estheticians doing laser epilation. So this is a really worldwide problem. And this absence of control on the competence of the practitioner, who can do which procedure, where can you do those procedures, and the result of all this is patient safety going down. And that is a big worry for ISAPS. Because of these dangers facing us, the patient starts behaving as a client, but at the same time expects all safety as in regular healthcare. So the procedure becomes a road to income, and with anyone doing anything about anywhere. So again, what to do? Well, I think we must be prepared. We must present ourselves as the protectors of patient safety, ethical, well-trained, and working in a safe environment. We have to remember everybody needs to make money, but we make money with what we do, but our reputation is what we decide not to do. So these safety guidelines are extremely important, and you need to be a competent, well-trained specialist who checks the health of a patient and manages their expectations, and then chooses the right procedure for this patient and chooses the right product, not to forget, and then executes that procedure in a safe and an accredited environment, that is the facility. So let me start with the first one. Dr. Cherkes will continue with the second and the third, and I will come back to you with the fourth. Competencies. When we talk about competencies, we believe, and this is a line that I took from the European standard on aesthetic surgery services, that practitioners should be monospecialty surgeons. We think it's extremely important. And this is in the European standard EN 16372. If we look at body injectables, we have to ask ourselves, is that for surgeons, or can any medical specialist do that? Can any medical doctor do that? What about dentists, nurses, or other? This is extremely important that we do realize that we need at least some knowledge of anatomy to be able to do that safe. And of course, we need proper training, and that is why these kind of webinars are extremely important. The training of the doctor has a huge impact on procedure selection and on patient management. And in this sense, it is very important that we all know our limits. Do you know what you don't know? I hope you do, because if you do, you're blessed, because you can get additional training. You will realize, I better go to some experienced colleague, or I do a fellowship, or at least I find out how to at least not get into trouble. I hope everybody of you is aware of the Kruger-Dunning effect. The big problem is that those who can't don't know it. It's an article that was written by Kruger and Dunning, showing that children in a class at the beginning of the year, the best children would always think that they would have lower results, and the worst would always think that they would have higher results. So they were not aware of what they didn't know. So if you don't know what you don't know, well, you're on your way to disaster. So we have to really be very honest with ourselves for the sake of our patient. After all, it's a huge responsibility. We as surgeons decide what sort of procedure we can do on a particular patient and in what environment we do that. So we at ISAPS believe that there are minimal requirements. I mean, a surgeon should be a board certified, preferably plastic surgeon, registered in the country of practice. And we do think we should subscribe to a code of ethics and work in an accredited facility. I will leave the next item to Dr. Cherkes.
In the patient management, consultation is very important, and to understand what the expectations of the patient is very important. And previous medical history, previous aesthetic surgical history, and physical examination, and what the patient needs, and diagnosis and treatment options should be consulted with the patient. Also, it is very important to understand the expectations of the patient. Sometimes it's more difficult than doing a procedure. You can do a right procedure on a wrong patient, or you can do a wrong procedure on a right patient, and you have to learn from your gut feeling. And management and communication with the patient is important, and we must be ethical. This should be much more important than on economic considerations. And patient safety is the most important issue in the surgical treatments. Slide, please. So make sure you have a healthy patient with reasonable expectations that you feel you can meet. And then choose the right procedure for these patients and use right product. After selecting the right patient, you choose the right procedure for the patient, keeping associated risk levels in mind. The higher the risk level, the more careful the selection process. So risk levels is categorized according to European standards. A is minimal risk, B impairment, C disability, D handicap, and E death. So, but sometimes in this scale, as you can see in this scale, free fat grafting to gluteal area is risk level is determined as C, which disability, but actually today many patients is dying because of the wrong application of the fat grafting to the gluteal region. So we have to consider these issues according to our knowledge and expertise. So aesthetic surgical procedures are subject to change. For exact definition of procedures, peer-reviewed journals, European and national competent organization, and authorities should be consulted. And every day new procedures and new products are coming up. We must follow product standards, and CE marking is very important in our applications. Procedures must be well researched and published in peer-reviewed quality medical journals.
So as said, sorry, Nazim, my turn again. So we have to follow the safety guidelines. So the last issue was the facility. We have to execute procedures in a safe and accredited environment. Now, what is the facility? You know, it can be an office where we do a consultation or an exam room. In a private clinic, you know, we can have an operating area. In a surgery center, they only have an operating area. A hospital is even more extensive, but basically a facility is an area where you carry out a procedure. And if we ask ourselves what type of rooms exist, I think we can determine that there are three types of rooms: exam rooms, procedure rooms, and operating rooms. Of course, then we have to look at the procedure. What is the procedure? Is it only a filler and only a toxin? Is it only a small injection that we can just clean and do? Or is it more extensive? Or is it an extensive operation? And what anesthesia do we use? Don't we use any anesthesia? Is it only local? Is it general anesthesia, or is it sedation? If we look at facility control, and I can look at the Belgium situation because I know that best. If we look at the hospital, it's really very strict. You know, the government checks the buildings, the materials, they have checklists, they check whether they are accredited. But if we look at private clinics, there's no controls. I mean, I opened in 2006 and I got accredited because I decided to do that. And I went to the American Association of Accreditation of Ambulatory Surgery Facilities because there simply isn't any organization doing that in my country. So I decided for myself, but I had no government control ever since then. So in over 12, 14 years being open, nobody checked. So this is a situation that ISEPS has recognized. So we've taken the opportunity, and I worked with Ozan Sozer on guidelines for non-hospital settings, but we want to apply that to all circumstances, and this is only to non-hospital settings. We believe that these guidelines are the absolute basic that everybody needs to have. And for now, they're voluntary for ISEPS members, but we recommend that in the future they will be mandatory, and we recommend that for everybody. What are these ISEPS facility accreditation guidelines based on? Well, they've been initiated starting from the safety diamond that you saw, and they're based on these two European standards and on the CODE-SF accreditation manual. And basically, the guidelines exist of general requirements, medical records, quality improvement, personnel and staff requirements, operating area, post-anesthesia and operative care units, and the sterilization. What does that entail? Well, it means that you need to have a proper infrastructure. You need a consultation room, you need a waiting area, and you need an operating room and recovery room. And you have to look at your equipment and make sure that that equipment is correct. And of course, you need lots and lots and lots of protocols. None of us really like these protocols and not to write them. But I think if you are a safe doctor, you look at each one of them, and I think you will agree that if you were a patient, you would hope that your clinic will have taken care of these protocols and at least have thought about the consequences of these protocols. We at ISEPS, we looked at all our members in the world, and we have members in 108 countries, and we found out that from 57 countries we got information, and only 39 of them have accreditation agencies, and 18 do not, so that's 32%. So if you work in a hospital, generally that will be checked, you will be okay. If you work in an accredited surgery facility, you're probably also okay. But if not, or there's no accreditation in your country, then you have to do it yourself. So we welcome you to download these facility guidelines that we have. We all need to focus on patient safety. We have to be ethical. We need to be well trained and work in a safe environment. So right now we're busy training inspectors, and we hope soon to be able to get an official ISEPS CODE-SF accreditation stamp. I'll leave the conclusion to our president.
Thank you so much, Ivar. First, we have to remember that we are a doctor first, and we must be ethical. And avoid patients with unrealistic expectations is important, avoidance of patients. And we have to know our limits, and we have to train ourselves. And we have to follow ISEPS patient safety guidelines, which are competent, well-trained specialists. We have to improve our knowledge and our skills. We have to choose the patient in good health and realistic expectations, and we have to use safe and accredited clinic and choose right procedure for the patient. And work in an accredited facility, follow ISEPS global accreditation guidelines. You can download it from www.iseps.org, that guidelines, and comply with the European standards aesthetic surgery services, EN 16372, and for aesthetic medical procedures, EN 16844. And just do it for your patients. Thank you so much. If you have questions, we are happy to answer.
Thank you very much, Dr. Nazim and Dr. Ivar. It is really important information about safety, and On that note, we are going to move into the presentation of Dr. Fantozzi, which will speak about clinical study about safety of gluteal augmentation with body fillers. Thank you.
Thank you, Anna. Thank you for the president, Doctor, for the safe guidelines, and good afternoon to everybody. Would you like? I have a disclosure with science, and because I am a speaker, and I want to share for bioscience. I want to share with you all my experience, scientific experience with bioscience today. And so in this webinar, we talk about gluteal augmentation with the hyaluronic acid, and I will explain the last clinical trial. And my presentation is 4 sections. The first part, we talk about gluteal augmentation and surgical and not surgical procedure. The second part is the bioscience clinical trial. And the third part is we talk about certifications about the HYAcorp. And we finally talk about the cases and so the results before and after. And so in the gluteal augmentation are really important, treatment now because is really increasing. And when we increase the volume of the gluteus, we increase the femininity and the sensuality of the body. In the last, since 2014, from some days from the Aesthetic Society of Plastic Surgery, increase the gluteal augmentation procedure of 90%. And imagine that every 30 minutes of every day we have a buttock procedure. And so it's very popular treatment. It has very high media attention. Because it's really important, the care of the body in the third millennium. Imagine that we care a lot about the health of our body, but too, we care about the beauty too of the body. And so it's increasing treatment about diet, alimentation, and weight loss, like post-bariatric surgery are increasing in the last 20 years. And for this reason, it is really important that when we change, when we reshaping the body, in particular the gluteus, it's important that will be very advanced treatment procedure and very safe. And we maintain the result for the time. That is very important. And we talk about the gluteus augmentation, and we have three types of augmentation of the gluteus. First of all, with surgical treatment, with positioning of implants. That technique is beginning from the end of the 90s, from Brazil, from Mexico, and is very great surgery. The only problem that the community of plastic surgeon only a little part perform this type of surgery. Is really important experience in this field, and we can have some complication, and that is very linked with implants, the position, the experience of the surgeon, the type of patient, and so it's not very safe treatment, surgical treatment, if you are not experienced in this sense like doctor. And but we discuss later about the complications. And so another type of augmentation, gluteus augmentation, is fat grafting. Fat grafting is really interesting because we can take the fat from the flanks, from the leg, and we can position, put transfer in the gluteus. That is very interesting procedure, and we have very great result, but is not possible to perform this treatment in a skinny patient because we have not fat, and there is a very open discussion now where is about the thromboembolism, and so we talk later about that. And we arrive finally in another type of augmentation that is with filler. We know from the past that we used permanent filler. Permanent filler was a disaster of surgery in general, in plastic surgery and aesthetic surgery, because now is avoided because we have migration, we have infection, we have inflammation, we have many necrosis, we have many complications. But filler like hyaluronic acid is different because it's not permanent, doing for 1 year, and we have a very large experience that hyaluronic acid for the face. In the last 20 years, we had very great results. But now we start a new cycle of hyaluronic acid for the body, particularly for a gluteal augmentation. So bioscience was to prepare a different hyaluronic acid, more stable, with the molecular weight more important. And so we arrive at molecular weight to 500 Dalton. If you compare with the hyaluronic acid for the face, that is 200 Dalton normally. That is more stable and is perfect, you know, to augmentation of the gluteus. And so now we arrive in the point, what is the ideal procedure? And so ideal procedure, there are many publications about that. And so imagine it, we have doctors, plastic surgeon, we have a patient, and so we arrive in the point. And so it's better to use implants, it's better to use fat grafting, it's better to use filler. And so now we try also to explain in some points only to find the right solution. I think there is any treatment as the ideal patient, and so it's a really important examination of the patient, and so to evaluation about the complications. For example, when we put a surgical treatment, and so when you use implants, we have the normal problem of the implants. And so the implants can produce inflammation with the tissue, and so like seroma, we can move, maybe because wall malposition of the implants, we can have some problem. And so that's is a surgery, and so is really important, you know, for the surgeon immediately understand if this treatment is the best for the patient. Like when we use a fat implant, fat tissue in fat transfer. So when we produce a gluteus augmentation with fat, the fat tissue, we can produce some problem. Sometimes the reshaping, and so we can have contour deformities. And we arrive at the point, you know, it's very famous Brazilian butt lift. Yet very famous in the last 10 years. It was very amazing technique with many plastic surgeons like to do Brazilian butt lift, and so with fat transfer. And we now start a new cycle of the fat transfer, because in the last 2 years we have a discussion and contraindication, something about the embolism, fat embolism that can produce this treatment. And so this treatment is a good treatment, but you need regulation. Is important. Study very well the patient, because we can arrive in a complication, a very serious complication. And finally, we arrive in our idea, like could be possible make a gluteal augmentation. And so we enter in the bioscience clinical trial. Remember that bioscience produced two types of hyaluronic acid for the body, is the HYAcorp MLF1 and MLF2. These two difference because we have difference in particular molecular weight. One is between 200 and 300. H2 is more stable, arrived to 500 of molecular weight Dalton. And the objective of the trial was evaluation very well about the patient. And so the evaluation was about the safety and the satisfaction, and to analyze the side effects, the pain, the satisfaction of the patient and the doctor too. And we, in this clinical trial, was three indicator. In the beginning, was investigation sites, was 3 sites, 4 sites. Duration, and so was about the study immediately after the treatment. The step 2 was after from the 4th day to 17 days after the treatment. Another follow-up was the 3rd follow-up from the 3rd month to the 6th month. And the last one, the number of the patient was 35. And so these trial timeline that was initially patient selection, method of injection, method of analysis, and to arrive to complete the trial timeline. And so the patient selection was 35 patients, 4 investigation sites, and before to participate in this clinical trial, there was necessary a written consent to participate in this trial. And in this patient, we had 9 smokers and 16 physically active patients, and 10 patients with prior aesthetic interventions. Interesting that about the method of injection, that's the amount of injection was between 85 and 42 ml of a product. Remember that this product has a very special cross-linking technology. We used a needle of 18 gauge, normal for 33 patients, and a needle of 22 gauge in 2 patients. I used the local anesthesia. And the injection amount and was between 85 and 42, and was the site that the part in the center of the gluteus was the part that we used more. And we only to explain the method of analysis that was recorded every day the side effect from the day of injection, and was a scale of investigation after the 2nd week and after 3 months until 6 months. And in the reality, the real side effect that we have seen was pain scale, was pain, and we make a scale from 1 to 10 of the pain scale for the patient. The patient was in reality the most important side effect, and that this pain is immediately after the treatment. It could be possible that as the pain, the patient, the gluteus for the first 2 days, And the range that we're talking about, the range of the pain from the 1 to 8 was around 2 or 4. And immediately the side effect was pain in 7 patients, and in 1 patient was hematoma. Immediately after the injection, no rash, no induration, no other side effect. Was only hematoma because they take a vessel only in one patient, and we not record a typical something in the very adverse side effect. And immediately the side effect was pain. And so this pain is the reason of the pain, that because we increase with volume the gluteus. Is like when you put implants in the breast, and so the depression of the new volume of the hyaluronic acid can produce immediately in the first days pain. But this pain, after when we analyze the patient, after in the second week, after the first week to 14 days, we see that this pain is not present anymore. We have in 9 patients we had swelling, in 6 patients reddening, in 4 patients itching, in duration in 2 patients, hypersensitivity in 1 patient, and only 1 patient was continuous a little pain of the gluteus. We have not, we haven't no rash, no hematoma, and not something of severe, severe complication. And we didn't use, some medicine to treat. After 3 months, between the period 3 months and 6 months, in the reality, side effect practically none, only 1 case of mild swelling. And in the reality, we have not reported extrusion of the hyaluronic acid, no infection, no reaction, no granuloma, and so none of these complications. And so if we see this graphic about the side effect, in the reality we have only, we have very, very low side effect after the treatment. The satisfaction of the patient is really high when we treat the gluteal augmentation in the center. We have in the site 3, and so the patient is really happy about the result, like the doctor too, because the doctor can see the gluteal augmentation very easy, only with injection of the hyaluronic acid in the office, and so no surgical treatment, very fast, very safe. If you maintain the right amount of hyaluronic acid, you don't go over, overdose of amount. In the conclusion, in this trial, we in these patient, 35 patients, in reality, we had practically absence of important side effect. In the reality, only pain in the beginning, but that is natural because you increase, the volume of in the gluteus, and so you have a response, a little bit of pain. And in this investigation, we can confirm that the product is really safe if you use in the right sense. And so that is a treatment that is possible to do in the office, but if you compare with the hyaluronic acid in the face, is really important, the asepsia. And so clean very well with the soap the part of the gluteus where you make the injection. You use the glove. You use is like, you imagine that you stay in the office, but it's like operating room. And so you are surgeon, you are doctor, and so clean very well, everything. You prepare well because it's injection. of hyaluronic acid that is like an implant, and so it's important to maintain, very clean the parts. And we remember about the certification of the HYAcorp is CE certification. The product is and so is really safe, and so has all the standard for a medical product that we can use in the European community. We remember that we have a renovation until May 2024 with CE mark. We have ISO Mark II, and the product of bioscience about hyaluronic acid is not only for the body but for the face too. We remember that this treatment is really quick. Is it possible to do in the office? It's important that your office has, maintain, the sterility of your act. That is important because you put amount of hyaluronic acid that is between 50 or 80 ml of a product. It is important that you prepare the patient, you make control like us after 1 week, after 3 months, or to be sure about all the post-op of the patient. And we remember that the product are 2 types of product. Is MLF1 for the body. That is important 2 things. That is the cross link, that is NAHA, and is important the molecular weight in MLF1. The weight is between 203 and 350 Daltons, and MLF2 is arrived to 500 Daltons, so it's more stable. For this reason, can maintain the presence of hyaluronic acid in the body for 1 year. That is really important to maintain the result, and so the patient are really satisfied. And so we talk about the gluteal augmentation, and we have very good result with the hyaluronic acid. But hyaluronic acid we can use for the hands to cover the veins and the tendons in the dorsum, in the hands dorsum, and we can use in the legs. Sometimes when you make a liposuction, maybe you have a little deformities or something after liposuction, and so with MLF1 we can treat these deformities. We can treat some cases the umbilicus when in person that use the piercing, or we can use in calves or in other deformity of the leg. And we remember that the bioscience has a very high technology in the production of hyaluronic acid, has very large experience in this field, and we can have a very scientific support from a big company about this product. And only to conclude with about the result. That's you can see the video. That only to resume some characteristic of this hyaluronic acid. We can pass after that about that's very important, the position when you make in this type of make injection. You stay in under the derma. Normally is the best place is near in the fat tissue over the muscles. And we conclude about the results. The results, we can show some results before and after. That's result you can do it in your office. Is very practical because It's very common that plastic surgeon sometimes when you talk with the patient, say, okay, I think that we can do glute augmentation, but I need to go in the operating room. And so many patients say, okay, doctor, but I don't like operating room. I worry, and so I would like to do something in the office if it's possible. And with this hyaluronic acid, we can do this performance. We can have a result. We can have in the office only with hyaluronic acid. It's really important to understand exactly, the limit of this type of augmentation. But when you achieve the experience to treat well these the gluteus with this product, we can have very amazing results. And so, thank you very much for your assistance, and I hope for any question I am ready here to answer.
Thank you very much, Dr. Fantozzi, for this very informative session. Now, if I could ask the participants of the webinar to please pay attention to the 2 live polls that you should see on your screens about now. Once you have filled those, we will proceed on with the agenda. Thank you. Thank you very much for sharing your opinion with us. Thanks. So moving on, we will hear from Dr. Krabai and his patient, who will share their first-hand experience in the trial.
Good afternoon. I wish to thank you, Joanna, and all the organization. I'm Dr. Piero Krabai, plastic surgeon. I'm working in Milan and Dubai. I was one of the 4 doctors invited to be part of the clinical trial conducted by Bioscience. I have since I'm using the HYAcorp and the Bioscience product for the body since 6 years, and I developed an experience in the right technique of infiltration. The trial was, as Dr. Fantozzi mentioned earlier, for investigation of side effects as well the satisfaction rate of the patient and physician on glute augmentation, especially with the product that is HYAcorp MLF2. I was pleased to be part of this research, as I'm thinking since a long time that the body fillers really could have a potential in the future in body volume augmentation, and the purpose of this research was to have a strong basis to proceed on one more other more specific trials. Then going on the details, for this type of study, I made investigation, I was the site 1, and I made investigation from the patient 1 to patient 11 on consenting all this patient, and were part of this site. 5 patients were from Milan and 6 patients were from Dubai. The oldest one was 49 years old, and the younger one was 20 years. The average was 35 years old. Most of my patients didn't have before an intervention, aesthetic intervention. Just 3 of them had other intervention like liposuction of the thighs, rhinoplasty, and mastoplasty. No one of them, of course, had any potentially cause an issue with the hyaluronic acid injection. I was able to inspect all the patients based on assessment on the quantity that was determined, and the maximum amount in the session was 60 cc, 30 each side, and the maximum it has been 120 cc, 60 each side. And after the injection of hyaluronic acid, I observed and recorded the immediate reaction that occurred. Going on the technical detail, following the protocols that before has been clearly explained, I treated with betadine part to be injected. Then I used the 18 cannula. I rather rarely use the 22 cannula. I didn't use local infiltration because I'm thinking that anesthesia can spread the product and make his dilution. So maybe it can create less stability and make probably the product can even have a migration rate higher. Then I only assessed the local anesthesia in the place where I started to inject, so in the place where I put the cannula. Then I infiltrated in the subcutaneous tissue, deep in the deep subcutaneous tissue, but over the fascia, muscularis fascia. And then after that, I spread the product and massage all the part to create a layer that has been completely even in all the part of the side that I treated. Then I usually tape the part, the side, to keep more stable the product, and I tape under the skin. And I don't do, of course, put any kind of stitches in the entry point. In this research, I didn't assess any kind of antibiotic, and I suggested in case the patient to take after the treatment ibuprofen 600 milligram, and in case to inform the operator to inform me in case if she had any other problem. For the results, I evaluated immediately the patient, and we checked me and the other surgeon in charge. We checked the patient in all the time from the first day to the 7th day after the treatment. And personally, I only had observed the one side effect that has been a slight hematoma that after 2 weeks has been recovered easily. Then other side effects like before was mentioned by Dr. Fantozzi wasn't present. Only the one that I observed more was itching and redness in the first 7-10 days. After that, I didn't observe any rash, any swelling, duration, and I didn't observe any lump appearing. And even the pain, as we are considering the pain scale from 1 to 10, was not so high, because the highest I recorded was 4 and the less I recorded was 2. This was coming because the technique I used was very light. I didn't push too much. I didn't use too much strength, and I was very soft in the injection. And after 15 days, in any case, I didn't observe any other side effects like redness or other problems. During the 3-6 months of a follow-up, the patient of my sites, they didn't have any delay side effects. After 4 months of the treatment, the patient demonstrated stable performance with no product loss reported. And as of the treatment, I'm thinking the technique and the skill of the operator and the level of infiltration and accuracy are very important. Moreover, the nature and the safety of the product and the CE certified give me the and the standard and the standards give me a successful result and keep me in safety position. And during this time, I also recorded the satisfaction of the patient with the treatment. Most of my patients were satisfied with results. 2 of them rating it as very good, 5 of them rating it's good, and 4 of them slightly improved. No one of them reported no visible improvement. I also found the procedure effective, and most of my rating rated very good, and good for the result demonstrated by my patient. As a physician, I'm very satisfied of the procedure, and I didn't find in this year any major complication using I'm using HYAcorp MLF2 and other body filler, since at the time is good to have is important to give the right indication.
Hi, my name is Ellen, and I took part in the HYAcorp body filler trial for the butt augmentation about 2 to 3 months ago now. So I'm just here to share my experience with you. The butt augmentation is something that I wanted to try for a while now, but after looking into surgery, it was a bit evasive and a bit extreme for me. So when this opportunity came along with HYAcorp, I jumped at the chance, and as it's CE mark certified, I knew I'd be in safe hands. So I met Dr. Krabby, who was doing the procedure, and he took me through step by step, very informative, answered all my questions regarding the actual treatment itself, the after effects, and then the actual final result. So I was quite comfortable then to go ahead. So on the day, after the anaesthetic, it was fine. It didn't hurt at all during the procedure. I was walked through it as well, so I knew exactly what was happening step by step. And then afterwards, there was no pain at first. I was fine. I drove home from the clinic, and yeah, it was great. I actually had skinny jeans on for some reason, but yeah, there was nothing. It was fine. And then after about what, 2 hours or so, there was a bit of swelling. And at first, it looks quite wide and high at the back, kind of thing. Not too much. As I said, I was able to get my normal clothes on, but it was just, I think it was just the swelling. And then it was a bit painful, and started getting a bit painful a few hours after. And there was redness where the actual needle had gone in, and also it felt like I could feel the filler. It was quite hard to touch in the areas, but again, fine. I had to sleep on my front, and yeah, I went to work the next day, was able to move fine. Just a little bit pain, but nothing, not an extreme. Able to sit down all day and work. And that continued for about 2 to 3 days, and then I noticed the swelling started disappearing, and the redness went, the bruises started to fade. After about day 7, I noticed that it was a lot softer to touch, but it was still firm. Like it's made the butt area firm, but it was soft. It was like natural soft. So that I was pleased with. And then yeah, it just continued to get better and better. So the swelling went down, the shape was great, it looked really natural. and I had like hip dips, and they were just filled out nicely. So I just think it's great now. It looks like an hourglass figure, just exactly what I wanted. Definitely recommend it, and I'd do it again. In fact, when the swelling went down, I was like, oh, I want more. So yeah, gets a bit addictive. But yeah, I think it was great procedure and no downtime. So yeah, I'd like to thank Bioscience and Dr. Crabby for everything, and I'll definitely be back in the future to see you. Thank you.
Thank you, doctor and the patient, for sharing their first-hand experiences. With that, we will move on to Dr. Brambilla, who will introduce the ongoing studies from Bioscience.
Good morning to everyone. Thanks for the opportunity to talk. It's such an interesting symposium organized by HYAcorp, such a good organization. So my talk will be on body contouring with a new system, new devices that are on the market, trying to focus on safety and efficacy. We know from data that the demand of Botox augmentation and in general body reshaping is increasing through the years. And we know that fat graft, gluteal implants, and composite techniques are the golden standard for us plastic surgeons. We cannot forget, on the other side, that not all patients are suitable for aesthetic surgery. Many of them ask for something that is less invasive, so aesthetic, non-surgical aesthetic procedures. So the global trend goes to non-surgical or to minor invasivity procedures. So the first question is, fat graft and body filler can compete? And the answer, obviously, in my mind is no, because there are different arrows for different targets. So in some cases, we can make our choice on a more invasive and stable procedure. In other cases, for minor cases, we may choose something that is non-invasive. The past. Hyaluronic acid for body contouring is not something new. In the past, we had a very good product, I think, that was Macrolane, that was on the market for several years, and there were very interesting publication about that with very good board of doctors with very good name involved in the study of the product. And the papers that were published were encouraging about the data. And we get to a starting point when Macrolane was took out of the market. And the reason, and those are my personal opinion because I know the product, it was mainly because of the inappropriate use by many doctors around the world of a very cohesive gel in body places where it had not to be implanted. It means in the face, for example. And on the other side, the inappropriate use of a product into the breast, because into the breast is very tricky and it gives many difficulties for breast diagnosis. So it was not the appropriate part of the body to inject it. And that guided the Galderma QMed to move it away from the market in order not to have problems. So it was not a problem of the product itself, but I think that it was a problem of misindications. The present is that we have now on the market a hyaluronic acid that is suitable for body augmentation, and we are talking mainly on the gluteus. But there are 4 key points that are patient selections, product rheology, knowledge of anatomy, and the proper technique, of course. About product rheology, HA with the concentration and the molecular weight and the cross-linking gives some specific rheological characteristics that are viscosity, elasticity, and cohesivity, and that changes so dramatically from one product to the other. So one product is suitable to be implanted in one part of the body and another one in another one. HYAcorp products, for example, have different ranges of viscosity and elasticity, so we have to choose the right one for the right part of the body. Technique, then, even this changes dramatically the result. For example, a fan technique versus a bolus technique are completely different, so we have to know and to understand the technique as well as the quantity of the product to be injected. About anatomical knowledge, Dr. Fantozzi already talked about that, but I want to struggle that anatomy is at the base of safety. Nevertheless, the quality of the product, I mean, we may have a thromboembolic problem despite the fact that we are using fat or hyaluronic acid. So we have to know exactly the area where we are injecting, avoiding all the risky areas, and that can be done just with a proper training of doctors performing the procedure. Future. We already heard about the studies that has been published previously and is in printing right now. But this, we thought that was not enough in order to give credibility to the product and to get more details about the product. So what we did is to start with a new study that now is ongoing on the use of HYAcorp in the gluteal area. This is a study that enrolled 80 patients with 7 investigators, and it will last 1 year with the 4 stages monitoring of the cases, and they will be evaluated at 1, 3, 6, 12 months with a subjective evaluation by psychological scores recognized by the literature, of course, by the report of all complications, and by the objective evaluation via echography with a high standard system of detection, with a 3D photography, and with the volume measuring via a 3D imaging. All that will help us to understand better the safety and the efficacy of the product, and we really thought that that was mandatory. Even because HYAcorp is a product that is on the market since so many years, we know that has been sold for years, and tons of hyaluronic acid of HYAcorp was sold with really little report of side effects. But we needed a more complete study in order to give credibility to the product. Thanks for your attention. I hope to try to be clear on what is said. Thank you.
Thank you very much, Dr. Brambilla, for sharing your insight. At this point, we will be opening for questions. For the time's sake, we will not be able to take all of them, but we will answer to all of those questions you submit by email. So let's start with the first questions. So first questions are in, and the first one is for Dr. Krabai. This is from Dr. Hernandez from Mexico. And the question is, what quantity of product do you usually inject for effective results?
Okay, the maximum amount I'm using actually is a 10 syringe per side in the button. Does it mean 100 each side? This is what, because I don't want to exceed too much because of the reactivity can be, the reaction of the patient can be more present as much as you inject. but the less quantity of product I usually inject to have an evident and to have a good result, and just to show the result, is 3 syringe each side. Does it mean 30 cc each side?
Thank you, Dr. Krabai. So the second question is for Dr. Brambila from Dr. Draganov from Bulgaria. And the question is, I am satisfied with the fat grafting, so why would I want to use your product?
Well, I think that is not my product, it's a bioscience product. What I think is that there are patients that are suitable for a minor procedure, and they want to have a small enhancement of the projection of the gluteal area, for example, and those are perfect patients. They come in, they go out, and I think that this is already a good answer. I mean, I don't think that this is the good product for big enhancement, big volumes, but for small volumes and details, definitely yes.
Thank you, doctor. And I have another one for you as well, which is what is different between MLF2 product and Sculptra for buttock augmentation?
I didn't hear your question.
The question was, what is different between MLF2 and Sculptra for buttock augmentation?
Are two different products with you cannot compare. I mean, we are talking about two different products with different principles inside, and everything is different. I mean, you cannot compare the quality of such different products. I mean, we are talking about different things.
Thank you, doctor. Now, the last question I have is from Saudi Arabia, from Dr. Mubarak. Can we inject MLF1 or MLF2 in the face? So I guess that question is for me. The answer is no. These are counterindicated to inject in the face because of the particle volumes. So these are only for body augmentation, not for the face. Thank you. Now, I would like to conclude today's session. Thank you very much for the panelist doctors, as well for the ICEPS members. We are gold sponsor of ICEPS and really are proud to have brought this webinar to you together with the association. And of course, thank you to all the attendees. We will be getting back to you with the questions that you have submitted. Also, as I mentioned in the beginning, for those of you who have stayed till the end, you will be automatically entering the draw, and you will have a chance of winning either a trial pack and the training for bioscience. The winner will be highlighted on all of our social media and also will receive a personal email. So stay tuned for that. Now, after this, you will receive an email with a small survey. We hope that you will be able to fill that survey and share with us your feedback. We would really appreciate it. With this, I would like to announce that this first webinar out of Aesthetic Reveal series is finishing, but we're looking forward to see you again for the next webinar of the series, which will be held on the 21st of November. Thank you very much, everyone, and have a great day.